Good morning and welcome to Cutis Cosmetic and Laser. We are here with Dr. Karen, and Karen is a dermatologist here at the center. You guys do a lot here. I just got like a 30-second tour of the building, and you're going to give us a little bit more of a detailed one. But you do a lot of cosmetic, and you do a lot of surgical as well.
Well, I'm not the one that does the surgical stuff, but Dr. Ron Lemkert, who's my husband and a head and neck facial plastic surgeon, he does the surgery, and so it works out well that we'll be able to look after all your needs that you have. So,
family-run business.
Yeah, absolutely.
Right here in
and our staff
Dundas.
are like family. We're very lucky. We've got wonderful staff who I know you'll get to meet and enjoy working with too.
That's amazing. Okay, so tell me more specifically what you guys specialize in. What do most people come here for? So
I'm a dermatologist, and I'll do both medical and cosmetic dermatology, so that anything with regards to the skin. Dermatologists, we specialize, we're your skin experts. So that's what I do. Anything with the skin, versus, skin cancer, cosmetic things, everything we look after and are trained in that. So it's important to make sure when you see someone that they're qualified in what they're doing. And we've certainly done a lot of extra training in the laser and filler, Botox, neuromodulators. And then Dr. Lemkert, where he's a surgeon, he does anything from like brow lifts to, facelifts, all sorts of things that require more surgical things. So.
Let's have a little bit of a tour. Maybe you can show us some of the treatment rooms.
Yes, so this is the waiting room, and we have our SkinScope with, we're a flagship store for SkinCeuticals.
I've heard.
So we're very proud about that.
I've heard so many good things about
Yes, so we exclusively carry the SkinCeuticals products, and they actually have studies behind the products that we sell. So we know that it actually does what it says it's going to do. There are a lot of other products out there that might say they do this or that, but when it boils down to it, they haven't got the research to back it up.
Interesting.
So we, where we're a medical facility, we like to carry the best.
Yeah, absolutely.
Yeah, and then in here, we do, this is our major laser room.
Okay.
So we have a variety of devices. We've got the BBL Hero, which is the latest, greatest for broadband light, which is great for red spots, brown spots.
Yeah.
And also
sun damage.
Absolutely.
Sign me up.
Yeah, absolutely. And we're going to have a little video demonstration of that a little bit later with our lovely volunteer.
Oh, yes.
And we've got Halo and Moxie, which is one of the newer devices for laser resurfacing. We have Clear V for fine blood vessels and leg veins, and all sorts of other devices here. Skin Tight, that helps tighten the skin too. So, you need something done, we can look after it all here.
You've got it all.
Yeah, we've got it all.
Coming up, we are going to be chatting with a couple of the nurses that work here. We're going to showcase what it's like for some of the procedures, and I might even get a little work done myself. Welcome back to Cutis Cosmetic and Laser Center. We are now in one of the treatment rooms watching a laser procedure happen. I'm being joined now by Dr. Ron. Before we get into kind of what you specialize here at the center, maybe give us a little bit of a background on what's happening.
So this is actually one of our lower level lasers, but it's a lovely one. It's Moxie. So this is a fractional laser, non-ablative. So there's actually a very quick recovery. It's good for people who want to maintain skin quality or get some correction.
Okay. So you're talking correction for fine lines, wrinkles.
Yeah, fine line, wrinkles, and pigment. Actually, this one's very good for it. And we often use it for people who have issues with melasma.
Okay.
Melasma is a particular problem with excess pigment in the skin. It's usually associated with pregnancy.
Okay.
But there can be other factors involved, and even men can get melasma sometimes, interestingly. So, so basically it's got 3 different levels, and it's safe to use for the face, the neck, chest, all areas of the body, really.
Amazing.
But those are the ones that we primarily treat here.
Okay, now you also do a lot of surgical procedures, and that's something that you specialize in. If I was to come here, what could you offer me?
So, we specialize in septorhinoplasty. My training is ENT head and neck, and then
that's
facial.
No's job.
Yeah. So,
okay.
Yeah, and then with that, extra training in facial plastic surgery.
Okay.
So So we actually do a lot of eyelid surgery here. So it's called blepharoplasty, but a lot of people want to treat the excess skin.
An eye lift.
An eye lift. We do brow lift as well.
Okay.
A lot of people come in and they think the issue is their eyelids, and for many of them, it's actually their brow. The brows have sagged, and it makes a big change. Just lifting the brows to the proper position.
Okay.
And some people it's both, or some people it is only their eyelids. But you have to have a proper assessment. If you really want the best result, you need to treat what the problem is. And then we do facelift as well.
I was just about to say, do you do full facelifts?
Yeah, facelift, neck lift,
Getting rid of the double chin and this and that.
And in fact, we have some very good devices that help us with it. Many people have excess fat in the neck, and I'm sure you've heard of people having liposuction in the neck.
Yeah, the waddle.
Yeah, but with liposuction in the neck, it is a sensitive zone, and so it's best to do it in a more controlled fashion.
Totally.
So we have the Vaser device, which actually uses ultrasound to help liquefy the fat.
Okay, yes, I've heard of that.
Yeah, so so it makes it very, very nice. I had a young lady we did it with recently. She's just ecstatic about the result.
Oh,
nice
that's
definition
so great.
of the jawline.
It's so nice to see people very happy with the results too. I bet that's the best part of your job.
Yeah, it is. In fact, that's really why I do what I do. There was one young lady, it was just last year, she came in, she had an injury to her nose when she was young, and all the kids at school used to just pick on her. And she was, you could see she just kind of wilted and withdrawn into herself. And we did her septorhinoplasty. The week after we did it, she came back to have the splint off and the smile on her face. And her mom said that's the first time she had smiled in a decade.
Oh my goodness.
And it's just like so transformative change that you can achieve. And gave her back her life. And she comes back for other things now, but just
to wave and say hi, even probably.
It's just lovely to be able to do something like that for people.
That's definitely one of the perks of the job for sure. Now, coming up, we are going to be taking a look at some of the skincare that they offer here and how incredible it is for your skin. And we're also going to be doing some Botox. Okay, I just had to use like an extra abrasive cloth to get all of my makeup off because makeup for TV is really heavy, because this would not work if I had my makeup on. What is this, Shane?
So this is a SkinScope. So this is a technology that we use that uses LED UV to look subsurface. So we're able to see things like pigmentation, congestion, capillaries, even hydration levels as well. So it really just allows us to make a very tailored recommendation for our skincare routines.
Okay, now the skincare behind us, tell us a little bit about that.
So this is
next level.
SkinCeuticals. We're so excited. We have a very awesome partnership with Cutis, and SkinCeuticals is a medical grade skincare line. It is the industry leader in over 44 countries with over 200 clinical studies supporting the product.
Wow. Do you use it?
I do.
Your skin is insane.
I do.
Like, your skin is so perfect.
Thank you. Thank you. Thank you. I've been using SkinCeuticals even before I worked for the brand, and so seeing how it really worked for my skin, but also patients that I've worked with in the past, really just made me want to work with SkinCeuticals.
Okay, so you've got the partnership here, and I feel like you guys have something coming up. What's the event?
So we do have an event coming up next week on the 10th between 1 and 6, and that is going to be a drop-in event where you can come and get a complimentary SkinCeuticals SkinScope analysis, so we can look deeper into the skin and then create a custom tailored skincare routine for you.
SkinScope analysis, and that's what I'm going to have done right now. So so what do I need to do?
So you're going to put your head into the scope.
Okay.
And it's going to be a blue light, so you can come all the way in.
It's like nightclub in here.
Yes.
Wow.
Alrighty. So looking at your skin specifically, we're seeing things like hyperpigmentation. We're seeing that you're around a normal skin type. So she's not super oily, but she's also not super dry.
Okay.
You can see some of the broken capillaries around the nose specifically as well. So this is where we can really talk to different treatments like BBL and different, skin resurfacing treatments to help with some of that hyperpigmentation. So really the goal of using this is that we don't have to make some crazy 10-step skincare routine. We can really make it as simple as possible to give you the results that you're looking for.
This is so cool. Now, like, why the blue light? Like, what is that what's showing you everything?
So the blue light has a certain type of nanometer. It just looks a little bit deeper into the skin. It reflects off of things like melanin. It reflects off of things like sebum as well. So this is really just showing us different things that we need to be looking for to really make those tailored recommendations.
I love how white my teeth are.
Yes, very white.
That's the best part in here. Jeez. Okay, so now if I was to come out,
Yes.
what would you recommend for my skin?
So specifically for your skin, I mean, there's a variety of different things. Typically what we recommend for someone who has a little bit of hyperpigmentation is, usually a vitamin C. This is Floritin CF, which is an antioxidant serum.
Cool.
So SkinCeuticals actually founded the vitamin C serum well over 30 years ago. So this protects your skin against UV. It lightens some of the discoloration, but also stimulates your collagen and elastin as well.
Oh my gosh.
We
It's like a
always
wonder
recommend,
product.
Yes, absolutely. It literally does everything you need it to do.
Okay.
You can even go in with a sunscreen. We
Yeah.
recommend for every single person wearing a sunscreen is absolutely essential in protecting your skin against, obviously UV,
Yeah.
preventing against skin cancer, and then of course helping to reduce hyperpigmentation on the skin. And then we can pair it with other types of treatments and corrective serums as well.
Amazing. Shane, you are great. You are
thank you.
super good at your job. I would
you.
buy all of these products, no problem, if I stuck my face in here and Shane was like, this is what you need. I'd be like, here's my money. Okay, we have so much more coming up. We're going to do a little bit of injection to get rid of my angry lines. I mean, my smile lines on my forehead. That's coming up on Morning Live, so don't go anywhere. All right, so it is now time to get rid of, not completely get rid of, but soften my forehead wrinkles. We are back with Dr. Ron, and I'm squeezing stress balls because it's supposed to hurt, but a little bit, but I don't really notice any pain. It's really not that invasive.
Yeah. So with me is actually Christy. She's one of our nurse injectors. Christy has done extra special training with the injectable course with the Canadian Aesthetic Medicine Academy. And then she's actually been tutoring with me now for several years and just learning all kinds of new techniques and intricacies. Nobody knows the anatomy of the face like a surgeon who's doing surgery continually.
I bet, yeah.
So anyway, one of the things we did is an assessment before Christy started, and if you have a look, you can see that the eyebrow on the right side is lower than on the left. And you mentioned you had troubles previously with an eyebrow sagging.
Yeah.
Right? Yeah.
Yeah.
So it's important to understand that, we have to tailor the injections
Yeah, not all
to the
faces are
person.
built equally, right?
Right, exactly.
I'm asymmetric.
All right.
But everybody is, right, to some degree?
Everybody is. Nobody's perfectly symmetric.
But I love that you guys aren't cookie cutter, right? You don't just take everybody's forehead and treat it the same.
No, it's an assessment for everybody. And we were talking earlier, and like Christy said, we want to start with a reasonable dose. We don't want to put in too much all at once, because if you have a really brisk response, you will not be able to move muscles in your face properly, and it's important for your job you're able to express yourself.
Yeah.
So, my philosophy with Botox is I really don't want anybody to have a frozen face. It's about modulating and improving the appearance. So Christy was cautious in choosing her dose, and if need be, in 10 or 14 days, we can add a few extra units in places so that we really end up with having a treatment that's totally tailored to you and gives you the result you want and need.
That's what makes you guys so special and so different here, is that everything is so tailored and so specific.
Yeah, well, in fact, everything's tailored. As you saw,
Yeah.
we offer the full range from skincare. Most people start off and they want to improve themselves. It's hard on TV now. So many people look at all these shows and you see all this crazy stuff, and everybody
Right.
starts thinking, oh, I'm a freak wanting to improve my face.
Yeah.
but really we just want to look like a better version of ourselves for the most part, and that, you know, that's what we're here to do. And depending on how far things are, sometimes it's just you know, skincare, other times it's skincare with a bit of laser treatment, or skincare with laser and a bit of injectables, and it's only at the ultimate end that we really need to consider surgery, you know, or for that person who needs that transformative change to improve
like
their
the
life.
girl with the nose job that you were talking about.
Yeah. I mean, this is about something that people do truly need. It's important to feel that we look good and that we have some worth. And a lot of people, when they don't look that way, feel down on themselves, and it makes it harder for us in life, and you know, so I think it's important to not poo-poo people who want to do these kind of things.
It's true, and a lot of people are doing it, and they're going to give you a skin analysis. If you come here on April the 10th between 1 and 6, you get to hang out with Shane, and he can recommend kind of what's going on with your skin and some of the amazing skincare to help improve it. Thank you so much for having us here today. We've had a lot of fun. I like the stress balls. They've been kind of my favorite part. There's a lot more coming up on Morning Live, and we're going to have all the information, including when you can come for the clinic, on our website at chch.com.